Alright, so here we are with the simulated skin model. So we're going to make an incision, and I've already actually done that, but I can just recreate what I did. So you want to put your index finger on top of the scalpel blade, where it's not sharp obviously, and use the blade to do the work. And then put the cap back on. And then if you look through, you can see that the pink represents your epidermis and dermis, and then the fatty tissue is represented by the yellow. Alright, so you want to make sure you got through all the way to the fats. Okay, now we're going to load our needle driver. So you take the needle driver, and we're going to load it this way, and I'm going to clamp it about 1/4 of the way up right before the needle starts to curve, right as it starts to curve. Right. So that's how it's loaded. Now I use my forceps with my non-dominant hand just to assist with the insertion of the needle. So I grab, and you can do this anywhere along the incision, grab some of the tissue on this side here, and I'm going to put, now I want the needle to be going into the skin as perpendicular to the skin as possible. So the idea is that I'm not doing anything to force the needle through, but I'm going to be doing this kind of a motion with my wrist. So it's really all in the wrist. So when I go in about this distance, maybe it's about 1 centimeter away from the incision, and just go in and then let your wrist do all the work. And then you can see when you open it up here that the needle is coming through the dermis, and then you want to put it back through the other side of the dermis. And so you can just take a look here, and so that's through, and then continue to just rotate your wrist, and now the needle has made its way through both sides of the incision. And I'm going to just grab the sharp tip of the needle, and pull the thread through, and all the way through until there's just a little short tail left. Okay, so now we're gonna tie the knot, and we're gonna use our needle driver to help us do that. Now the needle driver is always gonna be put in between the long end of the thread and the short end. Okay, so for the first knot, I'm going to wrap the long end of the thread 2 times around the needle driver. And so again, the needle driver is in the middle. So 1 time, 2 times, grab the short end, and now I'm going to bring the short end to the opposite side. And just make it tight. Okay, and then if you look here, you can see that, and you want your knot to be a little bit off to the side. So I'm going to keep stacking the knots on top of this knot. All right. So now I'm going to do the same thing in that I want the needle driver in the middle between the long and the short ends. I'm going to take the long end, and for this second time, I'm just going to wrap it around once. Not twice, once. Grab the short end, bringing the short end to the other side. And now you can see that there's 2 knots. They're stacked on top of each other. Alright, so go for the 3rd time here. Just wrap the long end around once. Grab the short end. Pull the short end to the other side. tighten it up. And for the last time, fourth time, just grab it around once. Grab the short end, pull the short end to the other side, and that's it. And now you can see how the knots have stacked on top of each other. And so that's good. I'm going to take our scissors and just leave a little bit of a tail so that it can be easily removed. And you're just going to continue doing this about every centimeter away until the entire incision is closed.